Morning stiffness is a common experience for many people, particularly as they age or suffer from certain health conditions. While some degree of morning stiffness is normal, prolonged or persistent stiffness that doesn't improve with movement may be a sign of underlying issues. Recognizing these hidden clues can be important for identifying potential health problems and seeking timely medical attention. One of the primary causes of morning stiffness is arthritis, particularly osteoarthritis or rheumatoid arthritis. Osteoarthritis, a condition characterized by the breakdown of joint cartilage, can lead to stiffness, especially in the mornings. Rheumatoid arthritis, an autoimmune condition that causes inflammation in the joints, is another common culprit. Both conditions cause inflammation and joint damage, leading to stiffness that typically lasts longer than just a few minutes. In addition to arthritis, fibromyalgia is another condition that can contribute to morning stiffness. Fibromyalgia causes widespread muscle pain and tenderness, along with fatigue, which can make mornings particularly difficult. Individuals with fibromyalgia may experience stiffness that extends beyond the joints, affecting muscles as well. Morning stiffness can also be linked to inflammatory conditions like lupus. Lupus is an autoimmune disorder that causes widespread inflammation and can lead to joint pain and stiffness, particularly after rest. Another underlying issue that can cause morning stiffness is psoriatic arthritis, which is associated with the skin condition psoriasis. Psoriatic arthritis not only causes joint inflammation, but also contributes to morning stiffness that can persist for hours. In some cases, morning stiffness may be a sign of underlying infection or illness. For example, infections like reactive arthritis, which follows a bacterial infection, can lead to joint inflammation and stiffness, particularly after periods of rest. Certain systemic conditions like gout can also contribute to morning stiffness. Gout is caused by uric acid buildup that leads to joint inflammation, particularly in the big toe, but it can affect other joints as well, causing stiffness that is often worst in the mornings. Additionally, chronic conditions affecting the spine, such as ankylosing spondylitis, can lead to stiffness in the lower back, making mornings particularly difficult for individuals suffering from these conditions. Stress and poor sleep quality can also exacerbate morning stiffness. Sleep disorders such as sleep apnea or poor sleep posture can increase inflammation and lead to stiffness, particularly in the spine and joints. In conclusion, if you experience persistent morning stiffness that lasts more than 30 minutes or is not relieved by gentle movement, it's important to pay attention to other symptoms such as joint pain, swelling, or fatigue. These clues could point to underlying conditions like arthritis, autoimmune disorders, or systemic illnesses that may require medical evaluation. Early diagnosis and treatment are essential to managing these conditions and preventing long-term complications. Consulting a healthcare provider for proper evaluation and guidance is crucial if morning stiffness persists or worsens.